Well, good afternoon and welcome to this SADS Foundation Heart of the Matter Question of the Month. I hope your June is off to a great start. My name is Michael Ackerman and I am the president of the Sudden Arrhythmia Death Syndrome Foundation and the director of Mayo Clinic's Genetic Heart Rhythm Long QT Syndrome Clinic and the Winland Smith Rice Sudden Death Genomics Laboratory in Rochester, Minnesota. I'm delighted to be with you today, and this month's question is a great one. The question is the do not take list a never take list, or can you take some of those medications listed under supervision with your physician? Thank you for that question. What the person is referring to is on the SADS Foundation website at www.stopsads.org is the do not take drug list, or the drugs to avoid list. You can click on that list and it takes you to a list of medications with known QT prolonging potential and potentially heart rhythm disturbing potential. This is a list of medicines that's maintained by Arizona CERT. And based on the published evidence, these are medications, and there's at least 50 of them approved by the FDA that can potentially prolong the QT interval in somebody who does not have long QT syndrome like myself. And for somebody with long QT syndrome, therefore the concern is even greater that the combination of that person's genetic abnormality or their clinical diagnosed long QT syndrome plus addition of one of those medications could be something that would then cause their long QT heart to spin out of control and then express itself with a long QT symptom. And as we know, those symptoms are a long QT triggered faint, or a long QT triggered faint followed by a seizure, or a long QT triggered sudden death. Now, these medicines on this list are across all different diseases and all different symptoms. There are anti-infection medications, antibiotics they're called. There are a variety of medicines. The bottom line with it is, although we tell our patients that the list of medications are to be avoided, that these medications are contraindicated, do not take them, that does not necessarily mean a never situation. For example, what if one of my long QT patients has a life-threatening condition for which I need to use one of those medications, or one of my colleagues who's taking care of that other disease needs to use that medication, and that medication happens to be on the drugs to avoid list. Do we avoid it? No, of course not. We would then need to make sure that we carefully use it, as the person who's asking the question is inquiring about. The questioner actually then asked, what about if a child has asthma? They're referring to that one of the asthma therapies, the inhaler, is on that list. Or they're referring to, my child has ADD, attention deficit disorder. And as the person who asked the question knows, is some of the stimulant medications are on that drugs to avoid list. The bottom line is everything needs to be carefully evaluated and discussed between you and your physician, your long QT physician, and if it's an asthma condition, your asthma physician or your ADD physician, and make sure they're aware that in general, the drugs on that hit list should be avoided. But if there's a situation where the benefit of meaningfully treating that other condition with a medication that happens to be on that hit list outweighs the potential risk of that medication irritating and bothering and triggering a long QT event, then under those circumstances, there are going to be times when patients of mine with long QT syndrome are in fact taking a medication on that list. Those occasions are few and far between, but they do occur. And it is very important that we treat all of our long QT syndrome patients, not just their heart. So it would be unacceptable from my standpoint to leave their asthma totally untreated, or to leave their ADD untreated, or to leave whatever condition untreated out of fear or concern that they can never use such a medication. So almost never should be the answer. Carefully with your physician, must be the rule. And in combination, I think we can safely take care of all of our long QT patients, not just their heart. So thanks so much for the question, and we look forward to being back with you next month. Have a great day.